This partnership was a really exciting opportunity because each of our organizations had worked with the Colorado Health Foundation independently. We were addressing similar questions, but from a different perspective.
There are times as a practice coach that you might feel on an island, and it's nice to be able to connect with different facilitators.
I think that we saw that we could come in and work with clinics around just team-based care and the building blocks of team-based care, but there were also gaps like the finance and the equity piece.
We were brought in to really help folks think about not only on the clinical side or on the operational side how folks are partnering, but really how do we make it financially sustainable over the long run to keep this kind of care going.
The work that JSI and CCHN were doing with team-based care, as they're helping clinics shift, moving to this team-based care model, there have been lots of questions arising around equity.
And so we were able to come in on cohort 3 and really just infuse equity into all aspects of team-based care.
What is exciting about doing this type of work through partnership is it allows us to provide more of a comprehensive experience for the participants, and at the same time allows for all of us to really be focused on the value that we can bring given our unique expertise in the space.
What's nice is I don't see us as 4 separate teams. I really see us as one team.
We tried to coordinate as much as possible to make sure we were not overwhelming clinics, to make sure we were being able to get all of the information that we needed for all of our various aspects of the work, and then work together to figure out, okay, well, if there's an equity need that has a financial implication, how are we working with NFF to make sure that we are, addressing those needs?
Because we have this whole menu of training and technical assistance that we can provide through all our partners, we're really assessing where they're at with each of the components, and then where do they want to focus on, and what resources do they have, and what resources can we provide.
All the sites are very different. Some really rural small practices, and then working with really large organizations and trying to figure out, a lot of it is the same coaching modality, but just getting a shared vision of where we want the project to go. We've had a lot of opportunities where we have a lot of questions around financials. NFF could come in and they were able to run long reports for us. So if they're trying to get more staff, if they're trying to sustain the programs that they're currently doing and actually have data behind it to support the initiative.
We talk all the time, essentially, in order to really be able to coordinate. We want to make sure that not only are we planning together and thinking about how we want to move forward, but that we could have sort of warm handoffs between each other and really know what all of the work is that's happening at each of the clinics.
Also being able to partner with Think Equity was wonderful because we could say, hey, we're trying to really build a cohesive team and change culture in the practice, and I need you to come up with some ideas for a 10-minute activity, and then I'd also like a half-day seminar. It
was challenging, but also really great to be able to model the team-based approach.
Talking through what are each of those practices working on, how we can complement each other, pulling each other in when we see an additional need.
We could hear about what was happening in the different angles, hear about what's happening on the clinical side, hear about what's happening financially, and think about how each of our components supported the other work that was going on.
Probably one of the most important roles that we have as a coach or a consultant is just creating the space and having someone help bring up questions, help you with your workflow, help you navigate what barriers you might be facing, kind of flesh out some of the deeper issues, and then to also acknowledge successes.
We have a mix of more one-on-one coaching and then peer learning activities where the practices can come together, the teams can really learn from each other and share.
Every single clinic is different. And so for me to be able to provide them the best technical assistance possible and really understand their unique story, I need to be with them. We look at clinic flow and efficiency as an umbrella. We are looking at their scheduling system, their no-shows, cancellation rates. What's the day in the life of a patient look like? Staff roles, who's doing what, sustainability, cross-training, things that really impact patient care.
Of course, the outcome that we're looking for is health equity. We're wanting to have an equitable outcome for the patients and the people that come to clinics, but that starts internally first. And so we really begin to deconstruct what is happening from the leadership level all the way down to the staff, through the staff to the front desk, and how diversity, equity, and inclusion is showing up or not showing up in a clinic.
Some of what we've been providing is very basic training for staff, just getting some common language and common frameworks across all levels so that conversations can be happening among staff members, between staff and leadership.
When we get that foundational piece kind of not acknowledged, we begin working on elements of culture.
As there's this environment that promotes equity and inclusion that then is going to spill out into patients being cared for better and receiving more equitable care.
What does it cost to implement team-based care? On the surface, it can seem like a fairly straightforward question that actually has tendrils and touches on lots of other components of financial management within the clinics.
Sometimes that might look like, doing projections to really understand if they were to make a change, how would that affect the finances of the organization. Sometimes it's really trying to understand the history of the organization and really understand the story behind their finances to help them sort of have that baseline to make those decisions moving forward.
For others, it's been a little bit lighter touch, more focused on coaching, education for staff, education for boards. NFF's goal in all of the work that we're doing in our consulting support to right-size the work and to really focus on what is the key or presenting issue for the clients that we're working with.
We are also looking at data throughout, so we are assessing the practices in the different aspects of team-based care, finance, as well as equity, and see where they're falling and measuring that yearly to see has there been progress.
Folks working in healthcare are very dedicated to the work. They really care deeply about the patients they see, they care deeply about their coworkers, and they really want the best outcomes for the patients that they're seeing. What we're doing isn't really trying to bring something totally new or kind of impose a different way of thinking about things. I think what we're doing is really helping people achieve what they desire for their patients. I
also am grateful for the opportunity to work with so many different, diverse clinics because I've got more knowledge and education behind what's actually happening with health centers, who's doing something that's worked really well, and just getting creative ideas.
One thing I've learned is that when you have one clinic, you have one clinic. They are not the same. Diversity, equity, and inclusion work is slow. It's like a marathon, not a sprint. I think it was beautiful to see kind of the myriad of ways in which clinics were coming into this work, and then how they were able to move the needle from where they started to where they are.
As a consultant, it's really easy to fall into the trap that, oh, I'm the expert. They were the experts in a really deep way. I was working with folks who had been in their role for 20 plus years and never developed a budget. And as a financial consultant, right, there's a part of me that's like, what? You've never created a budget? What do you mean? But that's because they just knew intuitively if they had this many patient visits at this point in the year, then they were gonna make their budget. So it became not about the best practices of let's do a budget because all nonprofits should. It became, how do you communicate that knowledge, that deep expertise that you have? How do you make sure that the rest of your team who don't have that tenure at the organization also know that?
Seeing what they were experiencing, how they were adapting, and then seeing where they're now, and all the amazing things that they've done, and how they've pulled together and pulled through it. I find myself saying that I'm lucky because I get to experience it and see it and learn from them.